My name is Tembi Aris. I am a medical intuitive. I use alternative techniques to diagnose and treat illnesses. I've done this for over the years, and I've successfully diagnosed and treated people with the most complicated of illnesses, which have baffled even the best of some of the medical specialists. People call me Dr. Alternative out of endearment.
Join us on their journey to better health and renewed hope. This is Dr. Alternative.
Welcome to Dr. Alternative Show. Welcome to Kabeja. We are back with the debate on medical issues or collaboration between alternative and conventional. So that's where our debate is going to be on. And it's not going to be a once-off, it's going to be an ongoing debate, because the whole idea is to make people understand the need for combining these two medical legs. And today I've got our guests who are going to introduce themselves. Over to you.
My name is Lilia Rubushe, residing at Kabeja, Central Richmond.
I'm Jason Walsh, currently residing in Kabeja in Corsten.
Welcome to Dr. Alternative. It's good to have you. I'm excited about the discussion. I don't know which direction it's going to go, but like I said, this platform we're creating so that we can debate, and we're creating topics for families, because when they watch this show, they must also start to engage as family members, start to look and understand issues about who is out there that is supposed to make sure people are healthy. And not just only look at the conventional side, but know that there are other alternative options, other alternative modalities. So that is what this debate is going to be about. So I'm going to hand over to you to kind of drive the questioning, because I'm going to be attending to your questions or answering your questions, some of which are actually representing the viewers' questions and out there. So over to you.
I've always having this question on my mind for quite some long time. There's a say that says there's a family history illness where maybe you have diabetes, and then they say just because someone in your family once had it, it's normal for you to literally get it. Yes. So I want to dwell more on that family history illness. Is it really existing, or it's just a belief that people have? Yeah.
All right. Well, yes and no. There's truth in that, but what I've found to be the belief that is shared even by conventional medical practitioners is that chronic illnesses, because remember there are illnesses which are chronic, like your diabetes, your high blood pressure, your cholesterol, your heart, those type of illnesses are regarded as chronic illnesses that kind of sit with you for the long haul. And they say once you have that, you're never going to come out of it. Okay. So conventional medicine believes that chronic illnesses are also are genetic, okay, in that you have inherited it from some family member. It doesn't have to be necessarily your immediate family. It may be granny, it may be, great-grand. So that is their belief, okay. But from us alternative, chronic illnesses may not necessarily be genetic, like historic, just because it sits in your history, in your family history, then you're bound to have it. Chronic illnesses are more lifestyle. More lifestyle. you will find that there are people that come from families that are sharing those or that are having those kind of illnesses, but who you find don't actually have that. Okay, they may have fears because so and so has got, and and so. But I just want to throw a distinction. Chronic illnesses are different. Okay, in their causes. Like for instance, if you're talking diabetes, diabetes has got different types. You've got diabetes, which is type 1, which is, or even type 3. Someone was shocked to hear that there is type 3 diabetes. I know it's there, but it's not really spoken about. The diabetes that occurs as a result of problems with the pancreas, that you can be sure you will inherit that. Yeah. So because it is not necessarily just a lifestyle, but you have some genetic issues that make your pancreas sit with issues. Like for instance, I give you an example. People that have got cystic fibrosis. Now, cystic fibrosis attacks those organs that have got mucus, that are mucus forming, like your lungs, your pancreas, the genitals, those type of organs. Now, when you have got cystic fibrosis, that's a genetic problem. You are likely to have pancreas being affected as well, because there are people who suffer from diabetes because of cystic fibrosis. Okay, so that is genetic. Whether you eat how well, that has got some bearing though in making you suffer more or suffer less. But if you've got cystic fibrosis, you're likely to have diabetes if it hits the pancreas. It doesn't mean when you've got cystic fibrosis, it will always hit the pancreas. It may concentrate on the lungs, make you have serious breathing issues, respiratory issues. So that's one. Also, people who have got multiple endocrine neoplasia. Now, that is another genetic condition that attacks the endocrine system. Endocrine system is a system of glands like your thyroid, your thymus, your pancreas, your adrenal glands, and the kidneys. So when you've got that condition, it may attack the pancreas. It doesn't mean when you've got that condition, it will hit pancreas. It may concentrate on the thymus, for all you know, or it may concentrate on your adrenals. That just doesn't follow that when you've got MEN, then you will have pancreatic issues. But when it hits pancreas, you're likely to have diabetes. So I'm just going to give you those two examples, that because those two examples are a typical situation where you're likely to inherit because it sits in your family history. Okay, but conditions also, but where diabetes is metabolic. Now, when it is metabolic, it has largely got to do with your lifestyle. Because if you eat unhealthy and all that, then you find you sit with metabolic issues then, that which may also affect your pancreas. So metabolic one may not directly be linked to your genetic problems or to your history. It may squarely be because of your life history. But having said that, you may also still have type 2 diabetes, which is genetic. In what way? People, for instance, I make an example, people who are fructose intolerant. People who are fructose intolerant are people who have got deficiencies of aldolase enzyme. Now, aldolase enzyme is an enzyme that processes fructose sugar. It has got 3 storages. Aldolase A is stored in the tissues, aldolase B is stored in the liver, aldolase C is stored in the brain. So now, if you end up having more tissues being affected, which is because of aldolase A. Now remember, the problem is coming from fruit. You're not supposed to have fruit because you're deficient on this enzyme, but you keep on eating fruit, so it ends up affecting your tissues. Then your tissues affect the reception of insulin, Because remember, insulin is pumped by the pancreas, but it's transported by the blood, and it's supposed to serve all the different areas where sugar is needed. But now when you are insulin resistant, it means even when the delivery of sugar carried by the insulin is delivered to your brain, to your heart, to your whatever, it is not received because the tissues are damaged. Damaged by what? Damaged by aldolase A deficiency if you eat fruit while you're deficient with that enzyme. I know this is a lot.
It's a lot to take in.
It's a lot to take in. But remember, I'm not just only talking to you, I'm talking to the viewers out there. So I'm just giving you those examples that there's some truth in it, there is also no in it. Okay. Yeah. So, but having said that, when you come from a family where there are issues of these chronic conditions, you need to be careful because it means you are predisposed, but you may not know if you're predisposed because of the pancreas being affected as a result of type 1 or being insulin resistant because of tissues that are not receiving the insulin or other conditions that may either fall on this side or on that side. All right. Have I answered you?
I'm answered.
Okay.
Literally, I'm answered.
Yeah.
All right.
Thank you so much.
Okay.
I have a question. It's not related to what she has asked, but this question it's been on my mind for quite a number of years now. We see the Rastas selling natural herbs and stuff. They're like outside of ShopRite or wherever they choose to set up their thing. And logically, I know that natural herbs is supposed to cure illnesses and sicknesses and diseases. But now, there's like, in modern times, there's like the Rasta selling herbs, and now there's a doctor. And now I'm thinking to myself, where do I go to? Because now I'm confused, because I know that naturally that we humans, we come from the earth and we are so essentially like part of nature. And so like logically it would make sense for something that grows naturally to help in healing me. So now I'm a bit like confused because the pills that I receive from the doctor, they are like manufactured in a pharmaceutical plant. If you can just answer me on that one.
Firstly, there's a space for both medical labs.
Okay.
There is a space for conventional and there is a space for alternative. But conventional has been running the show since donkey years, since they took over from natural. Because you must remember, before it was conventional, it was first natural. I mean, there were no modern doctors in the donkey years. But the doctors came up with something, even though other people are saying, no, because when they came with penicillin, for instance, when they introduced penicillin, and then it was, it's the antibiotic, it's gonna, So when they came up with some of these things, people are saying it helped because people were dying like flies when it comes to small viruses or bacteria or whatever that could have been killed, but then you find it takes longer. There's that argument. But then there's the argument that says when modern medicine was introduced, a lot of mess up was created. I mean, some people even point out the Rockefellers, because that's the Rockefellers who introduced medicine as we know it and decided which direction it must go. Even the curriculum, everything, the Rockefellers, they put together everything. So what we are taught at the university was determined, beforehand, and for the purposes that they wanted to achieve other than just health. Okay, it was more control than health, But having said that, because I don't want to get to make this, to politicize this. If you break your you traveling, you fall, you break your leg. Alternative medicine can never help you there. You need your doctor. For emergency medicine, you need your doctor because they know how to cut or how to, plaster you and what have you. So for emergency medicine, you need your doctor. But for chronic medicine, for chronic conditions, you need your alternative medicine. Even though conventional medicine is taking both emergency and chronic. Okay. Now, but we need both of these. Now you must remember, conventional medicine has done a lot of work. They've done a lot of research. So you need your medical doctor. But when it comes to herbal medicine, that's just a portion of alternative medicine. Because if you look at, like you correctly said earlier, if you look at creation, everything was created by God. Everything was created. Food we get from the soil. Medicine from the soil. Us from the same creator. The animals, everything that you find on our planet is not man-made. Whether you say, okay, you believe whatever entity you talk about that is divine, but with us it's God. Okay. So everything, and God gave us everything. Your medicine is there. Your up to the absolute minute need, He provided. But now, that the wisdom of knowing how to use that, He also gave. He gave us that wisdom. So we knew that you mix this with that in order to yield this result. And there were people who were the wise men, that knew how to, people who would consult. Because remember, all these different careers that we have as we have them today, they were there. They were there. So the people who knew how to treat, the community knew that you take to that person because that's how this person is gifted. He knows which herb to mix with. If you need someone to deliver the baby, you take to the to the midwife. Even fruit frows, that was it called fruit frows, that knew how to do all this natal care, antenatal care, that's done by the gynecologist. Those things were provided. They knew how to deliver a baby that is a breech. There would be no cutting. There was no scissor because they didn't know how to do. But they delivered those babies perfectly. So everything was there, Jason, just like you have correctly said. But when medicine took over, they confiscated a lot of things. They took over and they made it their own and they fashioned it differently so that it fits and it suits their own design. And in the process, they made sure that they confiscate the mind, the brain, your processing, your thoughts processes. They give you the information, like I'm saying, that now you believe that you go to the doctor, and like for instance, this thing that I'm doing as a medical intuitive, I work against the wall. In what way? When I come to you, like you're saying, at least the one of going to the herb on the street, that one is even easier because you would not want to go to a herb that's not been processed. You don't even know how he knows how to process it. But if you're talking about someone who's using alternative medicine, but who knows how to process that and make it presentable, clean, and all, because all those things, they matter, So that's different. So, and someone who knows, who's not just taking a chance, because you must remember, there's also a lot of chance taking out there. Okay. So, but it's years of indoctrinating people about conventional medicine is right. And not only did they indoctrinate by talking to you, they institutionalized the whole medical system. That at the university, this is what you are taught, and these are the results that they want, and this is when you are finished studying, this is the position, this is where you must be placed, this is the state. They placed even the status. All that has been put together, not by mistake. That has been systematized. That's a system. That's an institution that has been put together. So now, it's so difficult to now come to you and say, Jason, I know what's wrong with you. This is what is wrong with you. And your doctor is saying, no, she's talking nonsense. This is what is wrong. Who are you going to believe? Your doctor, of course. Even if he is the one that's talking nonsense, That's what's going to happen. Now, I give you an example. There is someone that I am trying to assist presently. She has got a problem of the knee. The pain is excruciating. And she's been having it for a while. And they thought it's arthritis, but now it's not improving. So, and then the sister is a doctor, so she ended up inviting, but she's out of the country, so she sent her to Cape Town to a friend doctor, and but no one is managing to fix that pain, So she was brought back. So I scanned her and I see, the problem that you have is McArdle's. Now, McArdle's disease is a sugar storage abnormality. Now, remember when we do cardio, we use the skeletal muscles. Now, the skeletal muscles, it's the muscles around your joints, your arms, your limbs, your heart. That's the cardio serving skeletal system, musculoskeletal system, because it's your bones and your muscle. Now, there is in that section, sugar is stored as glycogen. Okay, it's stored as glycogen. Now, as glycogen, when you need to use it, the body cannot use glycogen. It must be converted into glucose. Now, when it is glucose, the body can only use it as glucose. That's why you find people when they're gymming, they use energy, because that's also that's already in glucose form. But in your body, you've got to convert it. Okay. But now when you've got McArdle's, you are born without the enzyme that converts glycogen into glucose. That's one of the genetic, issues. And people that have got McArdle's, they have a kidney problem that runs in the families. Yeah, because this condition damages the kidneys very badly. Why? Because when glycogen is released, you're running, then the body sees you need sugar, you need energy, it releases glycogen, but because you don't have the enzyme, then the glycogen is not converted, it's toxic. So it can't go back, but at the same time it can't be used as glycogen. It must be converted into glucose. So when it's not converted, then it must be released as toxin. So it gets eliminated through your kidneys. So that is what is destroying the kidneys. But then the tissues also get damaged extensively. So now I'm sitting with this person. This person is sitting with this pain, and I tell her, it's not the knee, it's not a bone that is causing you to have this problem. It's actually a tissue, and it's affected by this damping of the glycogen. So, but then the doctors, they say, they tried, they scanned it for more than 3 weeks. They did the biopsy of the tissue. They confirmed it's not the bone, but they confirmed it's the ligament, the tissue, but they say she's got giant cell tumor. Okay. So here is a patient. I'm saying you've got a tissue damage, rhabdomyolysis, which is the inflammation of the tissue that is damaged because of this glycogen damping. But the doctor is saying you've got giant cell tumor. Who are you going to listen to? But now they don't want to treat her because they don't know how to treat that tumor, how to remove it. Now they want to send her to Cape Town because only Cape Town can do. Meanwhile, I know that's not the thing. I'm sitting here and I'm like, yo, how am I going to help this person? Because the problem is not this tumor. This is a tissue that's ravaged by the glycogen. So I can fix that tissue. But now who are you going to listen to? You're going to listen to your doctor.
Yeah.
Obviously. You see what I mean? You're going to listen to your doctor. Me, it's like, that mama, I mean, well, she's making sense, but she doesn't. But the doctor, then the doctor will show you on the scan that here, this is how it looks, and you see the scan. Meanwhile, it's your tissue. He says it's the tumor. I say it's a tissue that is ravaged. So what I'm saying is, it's a very difficult one. That's why we're having this debate, so that we can keep talking about these things up to be where people's minds are open and they start exploring their options and using their options intelligently. Let's go for a break, and when we come back, we continue with discussion.
If you are fructose intolerant, you should not eat fruit. Otherwise, it will harm your health extensively. This is a genetic disorder directly connected to adolase enzyme deficiency. Diseases including tissue cancer.
My name is Rachel. I am 35. Well, I was diagnosed with GIST, which is gastrointestinal stromal tumours. It's really rare. It's a form of sarcoma. It starts in the connective tissues, and for me that was the lining of my stomach.
Liver disorders and mental disorders. How do you know if you are fructose intolerant? And even better, what food you must eat.
Welcome back. We are having a debate it's a medical debate. We're trying to find common ground between conventional and alternative. And Holly and Jason are representing your views out there to see how do we craft this common ground, because seriously, it is necessary. Okay, back to you again.
Apparently, the question that he asked before, I have a family member that had a problem with stomachache, right? Okay, and then she decided that she needs to go to see a doctor because it's been happening for quite a long time. She went to a doctor, and apparently they said she has a stone in the stomach. Some claim it's an ulcer, some claim it's gallstone. Yeah. So she couldn't be operated because she's short and she has some So they said she should try to lose weight. Now she's losing weight, but they're still having difficulties to operate her. I don't know if it's the situation that normally happens that you need to literally, because she was 128 and she had to gain to diet to reduce to 115 kg. So I'm still can't pick up what happened literally, because it's been happening for some quite of time. It's 2 years now. She's been trying to lose weight and it hasn't happened. The operation hasn't happened. So I want to dwell more on, is it?
Okay.
Yeah.
Well, there's a possibility. You see, there's a possibility that it might very well be a gallstone. But the common denominator is the obesity, her weight. The liver is responsible for producing digestive enzymes for fat digestion. So when there are issues with the liver, you will find you will have issues with fat, with burning fat. And that's why you'll find most people, when they've got what is called nyongo, when they feel bilious, they become nauseous and they don't want to eat food that's got fat. Fat smells badly for them. Because when you've got bilious fever, it's the liver that's having that issue. Okay. But it is the function of the liver, not the liver alone. The pancreas also is responsible for producing the enzyme, lipase enzyme, for digesting fat. But the liver has got that primary function. So now the second thing is gallstones are a problem of bile hardening. Okay, now remember bile is also has got salts. Bile salts are that's what helps with the fat digestion. But now bile is made by the liver. A part of that bile is stored in the gallbladder, and part of it is used in the small intestine. This is where fat digestion actually occurs, mostly in your small intestines. So bile is sent there. Now, when she experiences that pain, okay, I don't know, I can't say it was gallstone, but it may very well have been a gallstone that is stuck. So the bile, when it's made by the liver, part of it is stored in the gallbladder, and part of it goes to your small intestines, which is where you digest fat. Okay, but now that bile is made constantly because you need it. Okay, but it should flow. It should flow all the time. So when the liver is working properly, and there are no issues, you find your bile flow is good. So as it's made, it goes through your gallbladder, some of it goes to your small intestines, and it keeps on doing its work. But then the question might be, what happens therefore to people that remove the gallbladder? Because there are people who have operations and they remove the gallbladder, which is the storage of the bile. When you don't have a gallbladder, that means your liver is working even harder because it must make bile as it needs because there's no storage. Okay, so but it doesn't mean when you don't have a gallbladder, then you cannot produce bile, you know. So that's one. But now but people who end up losing that gallbladder, it's when the bile hardens. Because it must flow, it must be free flowing. So it must not become stagnant, because when it hardens, it becomes stagnant. That's what ends up making it to have those gallstones, you know. And you'll find the gallstones are really hard like stones, you know. So it should always be free flowing, just like the blood. It must always be free flowing. But once you have issues with the liver, then you'll find the bile does not flow, then it hardens, it stagnates, then you end up, you know, having, you know, those bile salts, they crystallize, you know, then you end up having the gallstones. So that's what causes the gallstones, when there are issues with the liver. And then your bile hardens, and then it's stuck.
So how do you advise going about getting rid of that problem? Must the person lose weight, or what's the answer?
Firstly, when we work on, I'm talking now about us, that when we work on people that have got gallbladder issues or gallstone issues, you will find we're not just dealing with the gallstone, because when the liver has got problems, the problem of gallstone is just a small problem. When the liver has got issues, it will present with a lot of problems. Not just only the gallstone. Like for instance, there are people who cannot conceive, who are battling to fall pregnant because of the problem of the liver, because it messes up the hormones. Remember, the liver has got a lot of functions. It's not just only producing bile. There are people who you find have got skin issues, you know, they hyperpigmenting. Even these people that have got vitiligo, depigmenting, they've got white spots that end up that's vitiligo. That's a liver problem, because melanin That's also the liver function. There are people that you find have got, obesity, just like we mentioned, that are because of the liver. There are people that you find the moods, they get so mad, they get so irritable because of there are so many functions that fall within the liver. So the gallstone is just a small alarm to say, hey, I've got liver issues. But when we treat you, remember we scan you first, then we see, these are the issues that you are sitting with. It's not just on, like, for instance, I'm making an example, a person you find, this person has been trying to fall pregnant, or this one gets such serious menstrual problems, they've tried this, they bleed like crazy, or this one has just stopped bleeding. That's liver. Then you find you bringing that, then in the process we will also eliminate the gallstones. So that person who comes with a problem of the gallstone, then we eliminate the gallstone, but we fix a whole lot of other things that we see are happening as a result of. And weight, I promise you, the weight, you lose weight like crazy. Without us giving you any weight loss treatment or medication, that liver, because now we're getting that liver to do its function, then you find people come back and say, my husband is saying I'm losing weight too much, I must stop now. I haven't given you something to lose weight, but you're losing weight because I'm working on that liver, so that liver is shedding that weight. So even with your relative, you'll find that they will lose weight like crazy in the process of helping them to get rid of that gallstone. Yeah. If it is a gallstone.
She did, actually.
Yeah.
She did lose weight.
Okay.
I have this question of if there is, let's say that has been a thing in my family bloodline for the past 5 generations. And now I don't have diabetics. But now my question is, while I know I am healthy, can it be defined or divided in such a sense that I'm not liking carrying it in me, and then I have children, and then my children suffer from the, diabetics because I don't know what I have inside of me right now, because I'm healthy. But can it be like defied ultimately and completely be destroyed so that I don't carry it over to my children?
With all genetic problems, not just only diabetes, where all the problems that are genetic, you'll find there is that ratio that if you have it from one parent and the other parent is carrying the same gene, so you've got a double chance of having it. But you may not know, but because some people will say, my mother is diabetic, but my dad is not. But my grandmother from the dad's side had. So you find that it runs in both families. So you are predisposed. If I take you back, the diabetes in your case is as a result of pancreatic issues. But if it is metabolic because you live an unhealthy lifestyle, it's got nothing to do with your genetic makeup. Okay, so you still have to draw a line. But coming back to your question, if it is the type that is linked to the pancreas and you happen to beat it because of how you live, could you carry it to your children? Now, genetics are a very intricate process, if I may put it that way, because you may carry it. If you're carrying that gene, but it's a dormant in your case, you may transmit it to your child, and the child may have it. It's just like people that you find, like this example that I'm giving, people that have got vitiligo, this skin problem. You find that, or these people that are albinos, you find there's a parent who's an albino, but the children they manage to escape it because they did. But then you might find in the next generation there might be, or from these children, they might have an albino. because they're carrying it in their genetic line, you know. So if it is genetic, you are lucky to escape it. You are unfortunate to get it. Nobody can actually control the genetic makeup, how it affects you. So we all carrying something from the genetic makeup. Some are getting good stuff, some are getting bad stuff, you know, or a bit of both. But we all carrying packages from our family lines.
Okay, so you can't completely destroy something that is dormant in you. It's going to be there.
It's sitting there. It's not nailing you, but it's gonna nail whoever's
Who's gonna
unfortunate. Yeah. So that's just it.
So with it's actually different from with e-contraceptives, right? Is it normal when you're taking them that you don't have to go to your periods like for some quite of months or weeks, like because many people take contraceptives like implants and those 3 months ones, and they don't go to periods when they're on that injection of 3 months. And for implant people, they do, sometimes you go, sometimes you overflow, sometimes it just drops, sometimes you don't go at all. What literally happens in your body when you don't go to, because it's bound to happen as a woman, you have to, but what literally happens to your body when you don't go at all because of you on contraceptives?
Okay. Menstruation, this is what happens with menstruation. You see the uterus, the womb has got a lining on the sides which is called endometrium. Now that endometrium, that is where the egg, when it is fertilized, gets implanted, and you end up sitting with a baby. Okay. But that lining, when you are not pregnant, it sheds off.
Yes.
It falls away. It's gonna be put back again in your next cycle. That's what happens with menstruation. It's that lining, that endometrium. It's called endometrium. But now when you're taking contraceptives, you are actually messing up the hormonal processes. I mean the hormones, because remember it's the hormones that are released that carry out that function. So when you take contraceptives, it totally turns your hormonal balance topsy-turvy. That's making it not to come up during the cycle so that you can have a baby. If there's no baby, it falls away. So contraceptives are bad. Not gonna mince words. Contraceptives are bad for women. Okay. Because they tamper with natural processes. And therefore, eventually, because when that thing keeps on not coming, you're drying, I mean, that endometrium, it's drying, then you find you've got nothing to hold an egg. In some cases, even that egg is not produced because, remember, the whole system, all the different parts of your system, they talk. When it's the cycle, your ovaries, and they produce the eggs, the ovum. Now the ovum must, so the message, the brain is managing that whole process. The brain is saying, it's the 14th of the month, so we need an egg. So ovary, bring us an egg. So then you start ovulating. When you ovulate, you're releasing that egg. Now it's ready. It's fertile. I mean, it's fertile enough. It can be for fertilization. And if the sperm is good enough, then it fertilizes. Then, now all that process, while it's happening, the endometrium is also ready, because the message is, hey, put the lining there because the egg is coming. We might have a baby. That's all. That process is all occurring. So when you have messed up all that.
Is it possible for someone to be infertile because of contraceptives?
Oh yes. Oh yes. In other countries, there are certain contraceptives that have actually been banned. I don't want to mention them because I don't want to be in trouble. But there are contraceptives that have been banned because they make women sterile. That's a bad.
Strange.
That's a
Crazy.
bad one.
Crazy.
But shall I tell you that the contraception, there is a natural contraception that does not involve taking of pills and all that. But all that takes us back to nature again, because if you look at contraception, baby bearing of babies, it is something that God created for a family, for married people, for married people, not for entertainment, and no, serious. I mean, he created it for married people.
I was, I think it was 2 years ago. Yeah, when I injured my knee, but it wasn't like a traumatic injury. It was more like an exercise that I did, and then my technique was wrong, and the weight was maximum weight, and then so I had this problem where my knee is like an aching, and sometimes it feels like the bones is touching each other. And then I went to the doctor, and then he said that it's just inflammation. And he gave me some pills and stuff, and said that I must stay away from doing that particular exercise, mustn't put strain on the knee and stuff. But I don't know, but this is still going on now for the past 2 years. It's 2 years now, and it is still there, the knee. I don't know if this could be inflammation that for 2 years, because I've been doing some anti-inflammatory pills and some natural, but I don't know now. I'm at what's end with this knee.
Okay. Just describe the pain for me.
Okay, it's not a consistent pain. When I sit at a certain angle with the knee, then it feels like it's getting stiff now.
When you're flexing it?
Yeah, when I sit like that, I feel now I need to stretch it. Or, sometimes when it's too cold also, I can feel, hey, it's like there's no fat around the kneecap. I can just feel everything, stuff like that.
Okay. Do you ever, other than feeling it around the knee, do you ever feel that sometimes it feels as though that it's stretching to your leg or something? Maybe the top part of your leg. No, it's localized around the knee. But I would have to scan you to be able, because this is the thing that I always say that I don't operate from a symptom. I operate from the person. What does that mean? When I scan you, because, for instance, you remember I was just talking about someone who's got a knee problem, okay? And they say it's giant cell. I say it's the tissue damage because of rhabdomyolysis. So, but that's the symptom. But with me, I operate differently. I would scan you because your knee might be having a different cause from arthritis, because the assumption is it's arthritis when you're inflamed, or maybe you're losing the cartilage, or what. So I would have to scan you because there are many things that would cause that. So there are so many things that would have an explanation. But for me to be able to know exactly, I would have to scan you, and then I would tell you what is causing the problem in your knee. And in some cases you might find it's actually a clot. Okay, I've had situations where you find a person is sitting with a clot. Maybe it was the injury, and that clot is lodged in there, so nobody's noticing. I mean, I had one person who had a shoulder she was supposed to go for a shoulder operation, and was already booked, and someone said, go and check there with Tembi, and it was a clot, so I diffused the clot, and and the shoulder went back total operational, situation. So what I'm getting at is, I always move from the person to the symptom, so that I can see, in your case, why have you got a knee problem? In her case, why has she got, because you may have totally different causes, or you may have similar causes. So that's what, otherwise there are too many reasons why you would have a situation like that. I would love to offer that free scan for you, and then we can see what is actually causing your knee problem. But this is where we're going to end this episode because of time.
I'm actually glad to be a guest at Dr. Alternative Show. It's been quite interesting, and I've learned some things I never thought I would be learning, because I've never did life sciences in school. I'm an accounting student, so I don't know much about medical things, and I've been lacking somewhere. So, but now I think something is getting in.
Thank you guys for having me as a guest on Dr. Alternative. I've gotten the opportunity now to have my knee observed, and the show was quite informative. Thank you.
That's where we end our show today.